health, where yet another crisis seems to be looming in the health sector following a dispute between clinical officers and the Council of Governors over the Return to Work formula. Now, the COG, under the stewardship of Kakamega Governor Wycliffe Oparanya, issued a statement highlighting that implementing the agreement between the Ministry of Health and the health workers' unions will be costly, having not been included in the budgets. Now, meanwhile, the Kenya National Union of Nurses is set to have the final meeting aimed at ending the 30-day strike. Our Health and Science reporter Sada Hassan tells us more.
It is from one battle to another, and the end seems farther than anticipated. The Council of Governors now say that counties were not involved in the consultations, while some never experienced strikes negating the return to work formula. The Council further states that risk allowances capped between 500% and 650% will result in a ripple effect to other cadres, and the financial implication has not been catered for in the current budget nor the forthcoming financial year.
If you look at their own letter, they are admitting to the fact that they have no compensation for any clinical officer who is going to die in line of duty for their families, and their families will have to live in destitution.
In response to the Council of Governors, the clinical officers have issued a notice that is likely to disrupt health services in public hospitals.
The agreed return to work formula be fully signed in the next 48 hours to allow continuity of service delivery in our public sector, failure to which we shall go by the COG resolution that the return to work formula does not apply to them and shall resume strike without any further notice.
But the nursing officers are offering hope.
I can authoritatively say that we might have a white smoke tomorrow.
In the last 24 hours, 219 new COVID-19 infections have been recorded out of a sample size of 5,413. The total number of COVID-19 infections have now risen to 97,127. Recovered patients are 100, with 83 from home-based care program and 17 discharged from various hospitals. The number of recoveries now stands at 79,357. Unfortunately, 4 more people have succumbed to the virus, raising the fatalities to 1,690. Sada Hassan, KTN News.
Right, so that's right. My colleague Sada Hassan takes us to an interview this morning about the health crisis that is looming within the health sector. So far, we know nurses officially are on strike. Now, the clinical officers 5 days ago said they'd called off the strike, but then things have changed after governors said that they were not involved in the talks and that the agreement that the clinical officers had with the Health Cabinet Secretary Mutahi Kagwe was not budgeted for. To have this discussion with me this morning, I have 2 gentlemen from the Union of the Health Workers. So let me first introduce the Kenya Union of Clinical Officer Secretary General George Gibore, who's joining us. And of course, it's very good that we have him because he'll be talking to us about that 48-hour ultimatum that they've given to the government, both the national and the county government, so as to avert that looming strike once again after being on strike for close to 26 days. Now, other people, health workers on strike, that actually they began the strike yesterday. That is the laboratory workers, health workers. And with me this morning, I have Clifford Randa, the organizing Secretary General of the Kenya National Union of Medical Laboratory Officers. Also, he will be talking to us about that strike, how that strike can be stopped by both the national and the county governments. Gentlemen, Happy New Year, and thank you so much for joining us here on KTN News Center. Good morning. So now, let me begin with...
Good morning, and thank you for having me.
You're welcome. Let me begin with the SG of the Kenya Union of Clinical Officers, George Gibore. So as we speak, Mr. Gibore, where do we stand as a nation in terms of the strike? Because 5 days ago, you called off the strike. Then comes in the statement by the Council of Governors that has thrown things in disarray.
Okay, thank you again for having me so that we can be able to inform Kenyan on what is happening. And we, as a clinical officer, was in the strike, which started on the 7th December up to 1st, when we call off the strike, after having largely agreed with the government on a number of issues, where we documented over 17 issues, which was providing for us to go back to work. And I can be able to say that the Council of Governors and the leadership in the counties are not being sincere. That when the strike started, they have been involved in the negotiation all through a multi-agency team that was set by the Minister of Labor, Honorable Cherelgei, and they have been able to be involved in decision-making. The turn of the event is what shocked us, that what made them to change their mind. On the very material day that we signed this return to work is the day they were missing. But I'm privy, and of course I was present when they were being consulted over the phone, most specifically the Chair Council of Governors, Honorable Paranya, and he said that will be prudent for us to have a return to work so that we can have a gift to Kenyan in a new year.
So, Mr. Gibore,
and when they now changed their heart.
Mr. Gibore, allow me to cut you short so that to make it very clear to our audience. What you're telling us this morning is that the Council of Governors, throughout these consultative meetings, roundtable talks, they were involved. But they were not available on the day that you union officials were signing that return to work agreement with the Ministry of Health, CS, but the chair of the Council of Governors, Wycliffe Oparanya, was consulted via phone and he agreed? Is that what you say?
Precisely. Precisely. And that is why we are saying they are being insincere to Kenyans, and the change of heart is what actually is shocking us. If you look into their letter, they are talking about 2 return to work that has been signed. The only 2 return to work that have been signed is that of KMBDU and the clinical officer, which was awaiting their signature. It should be noted that the KMBDU, when they signed, Honorable Ngwae was present, and the CS Health was also present, and the CS Labor. And on the first, they were not all of them present because by virtue that they had traveled, and they were saying that they will be able to sign on Monday. And indeed, the governor, chair, Oparanya, actually congratulated KMPDU on 24th in his Twitter, saying that this was a good move and urged all of us in the leadership to follow suit. So they were fully knowing that the conciliation were going on at the Ministry of Labor, and they still acknowledge the same in the same letter, that there is a multi-agency team that has been doing this conciliation.
Right.
And this is what have resulted with this return to work. And there is no way they want to disown it and disassociate themselves from it after their change of heart. I think they have problem with the ministry and not the clinical officer.
So just before I bring in Mr. Randa from the laboratories union, just kindly confirm to us, immediately you signed the return to work formula with the CS, and there was no one from the Council of Governors to sign that document. Hours later or days later, have you confirmed whether that return to work formula agreement has been signed by the Council of Governors?
Yeah, we were present too, and of course that's why I said that they had agreed to sign out on Monday, and we were following that only to learn that they had issued a letter distancing themselves from this return to work. And that is why we have given a 48 hours notice to them, because the return to work was the one which was providing for our members to resume duty. Now, once they withdraw that return to work, the status quo ensue. So we will only be going by the advisory that the return to work does not actually service, and that's to mean that our members across the country shall resume duty, strike, and that's to mean that they have actually pushed us back to go back on on strike. And
But
you
then
should
if
be
I
able to
got-
understand that if you look on the issues they are highlighting, they have been telling Kenyans that they have met almost everything.
In fact, I was
and
getting,
one of the most
Mr.
important
Gibore,
things that we have been asking.
Mr. Gibore, I was getting into
Yes.
that because one of the things that the Council of Governors are saying, they're saying that counties are not involved in that decision that was being made, and you've explained that. They're saying that some counties are not involved in that strike. Some clinical officers never participated in that strike. They're saying that risk allowances that your union officials want will affect other cadres. Then they're also saying that it will not apply to them. So what is the way forward?
As I have said, of course, they have been living in denial, saying that there is a time they issued a list of more than actually 37 counties that were not on strike. Later on, they reduced it to 17. Later on, they went to 11. And this is living in denial, that the country is fully affected by the ongoing strike, and the issues that are affecting clinical officers are not county-based, but are actually centrally. Then they can only be addressed centrally. Right. And I need also to tell Kenyans that at the same time, I think on 17th December, they did a letter to the union advising them that they should be able to fast-track the negotiation of some of the items where they lack financial capacity and a policy to ensure that they are able to meet our demand. And so some of those are the 3 issues that they have highlighted on their letter, which we are actually pursuing. And we believe that the Minister of Health and the Minister of Labor have undertaken that to ensure that we can get harmonized service delivery, issues done across the country.
All right, let me bring in Clifford Randa, the organizing secretary of the Kenya National Union of Medical Laboratory Officers, and kindly confirm to us whether your strike officially kicked off, because you're supposed to kick off at midnight. Are your members at work or they are on strike?
Okay, thank you very much. I'm here to confirm that our members are out of the laboratory, and they are going to be out until the government do the right thing. It is quite pensive to hear what my counterpart is Secretary GS clinical officers are saying, and that could point to you how ingenuine the government, in fact the levels of government. We as the medical laboratory officers have been taken in rounds. Remember, one of the issues we are trying to push is...
All right, as we try to get a hold of Mr. Clifford Randa, because we need to sort out his audio so that we can be able to hear what he's saying clearly. But so far, he's confirmed that the members are on strike. They kicked off, they actually downed their tools as of midnight. That is the 5th of January. And so he'll be giving us more details later on. But let me continue having this conversation with George Gibore. So, Mr. Gibore, so here comes Council of Governors. They're saying that we were not involved, this is not going to happen. How sure are you, or what are you doing to ensure that within the next 48 hours, your union of members do not go on strike, but instead they continue serving Kenyans during this time of COVID-19? Are you having talks with the Council of Governors?
I think what we have done since we made this announcement, we have tried to reach out to them, including the Chair Council of Governors, but he has not been available to us, including the Chair Labor in the Council of Governors, Honorable Ngwae. All of them are not available. I think this is what we are saying, that they are not being honest, and we have been able to prove. And if the Minister of Labor can be able to prove all the minutes and also the attendance list, that the Council of Governors have been fully involved in this process, and they participated in the decision making. They are actually taking Kenyan into circles where we feel that they do not have the interest of Kenyans and the poor Kenyans who seek services in our public facilities. And that's why we are saying that they need to sit actually to actually stop somewhere and actually search themselves and get to realize that the direction they are taking Kenyans is not healthy, and they need to change and ensure that they are actually addressing the issues. And I need to say this. They have said that individual counties have addressed the issues that we have raised. But one of the fundamental issues, as I have said, is the enhanced comprehensive group life insurance, which they are actually disputing. And I need to remind Kenyans that on several occasions when they have addressed the media, they said that they have already provided this. But on the same letter, they contradict themselves by actually opposing what the ministry is putting in place and the state, because they have clearly put it that the president is the one who intervened to bring us to this stage. And we want to say that our goodwill is being taken for granted by the governors. And that's why we have given them 48 hours. Because what provided us to go back to work is a return to work. Once the return to work has been taken away, and it is not now in place, then the status quo ensues. People go on strike, and the strike continues, so that the negotiation to bring people back to work, it can be able to continue as they are saying.
All right, so Mr. Gibore,
as they are saying that we need to demarcate issues.
All right, Mr. Gibore, allow me to cut you short, because I need to hear from your colleagues, but from the
let me finish.
I'll be coming back to you. I'll be coming back to you, Mr. Gibore. Just stay with me. But I need to hear from your colleagues, the nurses, who are also on strike. But of course, Seth Panyako, the Secretary General of the Kenya National Union of Nurses, said that there is a bit of some white smoke, so the strike might be called off. But then what are the members of the Nurses Union in Mombasa saying? So, crossover live to my colleague Tobias Chanji, who's with them. Tobias Chanji, good morning. So, Panyako says the strike might be called off today, or it might not, depending on the agreement they'll be having with the government. But what are the members of the Nurses Union in Mombasa saying about the strike?
Okay, very good morning, Brenda. Remember that when it comes to Mombasa, it is unique, as they've been having two kinds of strikes. There's one that is related to the other counties nationally, while there's another strike that was running concurrently that also relates to them in Mombasa County. And it is now almost 2 months since they started their strike. On one hand, the doctors are saying that they've been given show cause letters, and actually after this interview, we'll also be crossing over to doctors and just hear what they have to say. But for the nurses, they also say that the county government has been threatening them and intimidating them by recalling those that are on leave currently. But just maybe allow me to speak to the Kenya National Union of Teachers, of Nurses in Mombasa County, that's the Secretary, Peter Maroko, to maybe just delve further on this matter and explain to us maybe what is the situation.
Yeah, the situation has remained the same for 2 months because the county government of Mombasa is very reluctant in addressing the issues that we raised before them. So far, since we raised our strike notice with the county government of Mombasa, they were only able to address the salaries of the month of November. And so the issue of remittances are still outstanding. They have been so much reluctant to engage us, even bring forth even a small workable solution for us to be able to negotiate and return to work. So far, we are aware that the county has been able only to pay up to the month of August, and we have all 4 months, that is September, October, November, and December, outstanding. And wherever we engage them, they are unable to commit on how to address the issues of remittances. And we are very much actually annoyed now because they have taken unorthodox methods in trying to address the issue of the strike. Instead of bringing the solutions as they should, they are actually going for our members who are currently on leave. There are those who have been instructed, especially managers, have been instructed to ensure that people report back to work using all other means. That's unorthodox for us. We believe the county government of Mombasa has a better way of addressing our issues. They would rather pay the remittances. This is the month of January, since we started raising these issues from the month of June. So we believe that the county government can find a better way to ensure that our issues are addressed, especially to do with the remittances. We know we are in January again, other issues are also cropping up. we had issues of promotions. They are coming up because we had agreed that coming the month of December they were to do advertisements. They have not done this. This is January. We were expecting that in January they were to do competitive promotions, which are again now, as for us, they are outstanding. Nationally, I want to actually look at the way the Council of Governors has actually decided to address our issues. It's uncalled for and insincere for the Council of Governors to discredit the agreement that was entered between the clinic officers and the doctors. That tells us, even as nurses, whatever we are engaging on, we need to be very sure that the Council of Governors is going to implement. If the Council of Governors writes back to the national government saying that they are unable to not be able to address the issues that were negotiated for, then they want to tell us that the strike needs to continue until they find a solution. Issues to do with the compensation of families that have lost their loved ones is non-negotiable, because to compensate is something that is already in law. The occupational safety laws actually outlines on how this compensation is supposed to be done, and therefore we need not to negotiate for this. The government needs to provide a life insurance cover and a group insurance cover for the families that have lost their loved ones.
The last time we spoke with you, you had a protest at a procession towards the office of the Mombasa Governor Ali Hassan Joho. What's the outcome so far?
Nothing really much has come out. The governor could not meet us. Instead, his officers met us on the same day at 2, where they were begging us to return back to work as they address our issues without putting anything tangible before us, so that we can actually negotiate from that end. So since that time, nobody has been able to approach us so that we can again go back to see whether they have been able to remit any amount of money. We are aware that equity, those who are earning their salaries through equity and have loans, have no problem. So we believe the county government of Mombasa did something to Equity Bank, and we are calling upon them to ensure that they do the same approach they used with Equity Bank, they apply it on other banks. Yeah.
Thank you a lot. That is Secretary, Kenya National Union of Nurses, Mombasa County, Peter Maroko, just painting for us a picture of the situation here in Mombasa. Later on, we'll also be joining the doctors to also give us a brief on what they are calling threats from the Mombasa County government after they were written letters of show cause. From here, it's back to you in studio.
Thank you so much, Tobias Chanje. I know you'll be giving us that live coverage. And of course, we continue this conversation with the Kenya Union of Clinical Officers Secretary General George Gibore, and also Clifford Randa, who's organizing secretary of the Kenya National Union of Medical Laboratory Officers. After the short commercial break, I'm taking right now here on KTN News Center.